All right, so today I am here to, again, my name is Jacqueline Hawkins. I'm an associate professor in the School of Social Work at University of Michigan. And the title of my presentation and what I'm going to be talking about today is type 2 diabetes in African Americans. Some lessons that we've learned through research and the road ahead. So first I'm going to chat a bit about what diabetes is for folks who are on and don't know, just to get us all on the same page. Then I'm going to talk a little bit about who's more likely to have diabetes. I'll also discuss what increases your risk for diabetes and diabetes-related complications. And next, I'm going to go over some best ways to manage your diabetes, and I'll end with some concluding remarks. I tried to make things a little bit more brief. There's a lot to cover. So we're just going to hit some key points today for folks who, who are at risk for diabetes, who already have diabetes, type 1 or type 2. Think of this as a little bit of a refresher with some reminders of what diabetes is and what puts you at risk for it if you don't have it. And also, I just want to leave you with some tips to lead a healthier life. So first I'm going to go over a little bit of background before we really get into things related to diabetes. So for people in the room who might be unfamiliar with diabetes, diabetes is a condition where the body does not properly process food for use as energy. So we eat food, our body turns it into energy so we can get up and do what we need to do. So most of the food that we eat, it's turned into something called glucose, or you could just think of it as sugar for our bodies to use as energy. And everyone has something called the pancreas, and that's an organ that lies near the stomach, and it makes a hormone called insulin. And the role of insulin is to help that glucose get into the cells of our bodies so we can have energy to do what we need to do. So when you have diabetes, your body either doesn't make enough insulin, so that's type 1 diabetes, or it can't use its own insulin as well as it should. So that's type 2 diabetes. What this does, if it's unmanaged, is it causes sugars or glucose to build up in your blood. And that's why a lot of folks refer to diabetes as sugar or the sugar because of the role of glucose in sugar. So again, what is diabetes? There are a number of symptoms for folks who know someone who got diagnosed, if you think you might have it, if you're experiencing any of these things, this is just stuff to look out for. So again, people who think they might have diabetes must visit a physician for a diagnosis. So no self-diagnosing. If you feel like you meet any of these criteria, and I'll talk a little bit more about what to say to your doctor and when you should go. If you think you have diabetes, it's important to go to your primary care doctor or the physician that you see regularly and ask to get screened if you haven't already. So some symptoms you might have some of them, you might have all of them, you might have just a few of them. Is feeling tired and sleepy, confusion or passing out, stomach pain, frequent urination, excessive thirst. You might have unexplained weight loss, extreme hunger in some cases, a tingling or numbness in the hands or feet. You might have very dry skin and sores that are slow to heal. So let's take a step back. Who has diabetes in the United States? Well, the answer to that is a lot of folks. So in 2019, around 37 million Americans, or about 11% of our population, had type 1 or type 2 diabetes. Now, out of those 11% or 37 million people, about 28 million were diagnosed and around 8 million were undiagnosed. So we have a lot of folks who have type 1 or type 2 diabetes who aren't aware, haven't been screened, haven't been diagnosed by a physician. And you think about men versus women. For men, type 2 diabetes is slightly higher in the US and a bit lower in women. In terms of race and ethnicity, it's important to know that African Americans are one of the highest groups that are more likely to have type 2 diabetes. So it's important to yourself get screened and also talk with family members who might have some of these risk factors to go and get screened as well by their primary care doctor. In Michigan, our rates of diabetes are around 11%, so about the same as nationally. And again, in Michigan, men and women have about the same rates of type 2 diabetes. Again, who has diabetes? So you're more likely to develop pre-diabetes as you get older. And pre-diabetes is just a precursor to type 2 diabetes. So when you're at the pre-diabetes stage, it's possible to change things about your weight. It's possible to take medications. It's possible to change things about regarding what you eat and your physical activity in order to bring your risk factors down to prevent yourself from getting type 2 diabetes. So you're more at risk for prediabetes increasing after you hit 45. That's why it's important for folks to go in and get screened, because if they catch you at the prediabetes stage, you'll have an easier time if you do what you need to do to get out of the prediabetes stage and prevent yourself from getting type 2 diabetes. The other thing I want to say is the rate of type 2 diabetes diagnosis is highest among older adults. So if you're over 60, you're much more likely to get diagnosed with type 2 diabetes. Again, thinking about African Americans in the US, around 3 million or about 13% of all African Americans who are 20 years or older have diabetes. Of these folks, 25% of African Americans between the ages of 65 and 74 are impacted. Diabetes is also the fourth leading cause of death among the African American community in the United States. And 1 in 4 African American women over the age of 55 years has diabetes. So I want you to take a step back and imagine that you're 60, you just got diagnosed with type 2 diabetes. You'd always considered yourself in good shape with not the best eating habits, but reasonable eating habits. You experience some leg cramps, some excessive thirst. You go to the doctor and they test you for diabetes. You find out that your sugar levels are off the charts. So now you have to traverse all of these barriers. How do you juggle the demands of your home life, manage your diabetes, attend all of the numerous doctor visits after your diagnosis, deal with a pandemic, in addition, and cope with an ever-changing economy that we're living in today? So there are folks like me who are focused on trying to answer these questions, specifically for African Americans with type 2 diabetes. So I want to ask everyone who's listening here, you don't have to respond in the chat or unmute yourself or anything. I just want you to take a moment and think about the answer to this question. People with type 2 diabetes cannot eat sweets. Is that true or is that false? Just ponder it for a second. Okay, you're thinking about it? Can people with type 2 diabetes eat sweets? That's false. They actually can. So people with type 2 diabetes, you need to watch your weight and you need to maintain a healthy, balanced diet, which I'll talk more about later. But in moderation and as part of your healthy meal plan, desserts or other sugary foods are not off limits as long as they're in moderation. So now let's jump to, how do you manage diabetes? And I just want to give you a glimpse for those of you who need a refresher, or for those of you who might be newly diagnosed, or for those of you who are thinking, hey, I need to get into the doctor and get tested and see if I have type 2 diabetes. This will give you a sense of what it means to manage your diabetes. So first I'll say, it's a very tough health condition to manage. I'm just including these things here to help illustrate that there are also some really severe consequences and complications that can happen if you don't manage your diabetes appropriately. So when you have a type 2 diabetes diagnosis specifically, you have to engage in several diabetes self-management behaviors that are critical to living a healthy life with diabetes. So why is knowing about and managing your diabetes this important? So if it goes unmanaged, it can be life-threatening. So for instance, you can get complications from diabetes that can lead to health conditions such as diabetic retinopathy, which can impact your vision. Also, because there's a lack of blood flow that's caused by diabetes, your unmanaged diabetes can lead to nerve damage in your feet. It can lead to amputation, and it can also lead to kidney issues. So what is diabetes self-management? It means a daily adherence to a rigorous routine. What is that routine? Well, it's typically defined as checking your blood sugar daily, taking any medications, like I mentioned, having a healthy diet, regular exercise, and checking your feet for sores. And these are just a few activities. Just 1 second. These are just a few activities that folks with diabetes need to engage in every day, or put themselves at risk for some of the serious health conditions and consequences that I just mentioned. So let me throw another poll question at you. People with diabetes can feel when their blood sugar levels are high or low. Do you agree? Do you disagree? Take a moment to think about it. We got it sometimes. So in general, the answer is false. And when I give this presentation, folks are pretty surprised because either they themselves have type 2 diabetes and feel like they know when their sugar is high or low, or they know people who can tell. The answer actually is false. Why? You might feel certain symptoms like weakness or fatigue if your blood sugar levels are high or low. But the only way to know your blood sugar levels for sure is to test them. So sometimes when people believe that they can feel, based on how they're feeling, what their blood sugar levels are, it might be inaccurate. The best thing to do is for you to test. People who don't test regularly may have blood sugar levels that are high enough to damage their body without them even realizing it. Again, what are some things that you need to do to manage your diabetes? I'm going to go over some specifics. So eat a diet with lots of plant-based foods, fruits, vegetables, legumes, whole grains. And I work with certified diabetes educators in the community in Detroit and in Washtenaw County. And we always get the response, those things don't taste so great. They're different from what I'm used to. I have cravings. Well, it's important to remember that you can cook these things in ways that do make them delicious. You could add some spices. You can get creative. So it's not the end of the world. Eating healthy and incorporating these things in your diets can be done. And people do it successfully in ways that work for them and prepare them in ways that are delicious for them. And again, like I mentioned earlier, sugary foods, things that you love, they're not off limits at all, but it's important to have them in moderation. What else? Get moving throughout your day. Incorporate physical activity into your day. That doesn't mean go hit the gym and lift weights or run on the treadmill necessarily. If you are motivated and physically able to go and do those things, that's wonderful. But when I say get moving, I mean, go for a walk around the block. Go outside and check the mail. That might even just be getting up from bed and going to another room and sitting in a chair. Whatever works for you. Manage your stress. Think about whatever you do to relieve stress, whether it's watching a TV show, is it talking to a loved one, is it going to church, is it spending time alone, is it spending time with friends, is it hanging out in the barber shop? Yeah, absolutely, Wilma or Miss Stringer. There are other cultures that have foods as well. What you can incorporate fruits and vegetables that are plant-based that taste delicious. So open your mind to different ways of preparing foods. Also, make sure you're taking your medications, whether you have diabetes or pre-diabetes. So I worked with one of my diabetes educators on this presentation. And this was one of the points she really wanted me to reinforce with everyone is if you have a type 2 diabetes diagnosis or a pre-diabetes diagnosis, and you're on something like one really common medication is metformin. Some people have injectable insulin. There are a number of medications. It's so important for you to take those medications the way that your doctor instructed. So remember to take your medications. There's a reason why you were prescribed them in the first place. And it'll help you to not have to deal with some of the really intense consequences of unmanaged diabetes. I see your question, Dr. Mitchell, and I will get to that actually on my last slide. So again, how do you manage diabetes? Is stop or reduce smoking. That's another point my diabetes educator really wanted me to reinforce is we recognize that that's easier said than done, which is why I added here reduce. Smoking unfortunately has some negative consequences, particularly with older adults and folks who are living with chronic illnesses like type 2 diabetes. If you can talk with your support system, family members, loved ones, and your doctor about ways that they can help you to reduce if you don't feel like you can quit, and if you don't want to quit, or to stop smoking. So reach out. Also, get a good night's sleep. Folks don't realize how important it is to get a good night's sleep. Stay on top of your yearly physicals with your doctor. So it's so important if you're at risk for, or you have pre-diabetes or type 2 diabetes, to make sure that you go to all of your appointments. Most times you'll be seeing an endocrinologist. They might refer you to a dietitian, but at the very least, make sure that you go to see your primary care doctor. So do your best to try to not miss those appointments. Like I mentioned before, make sure you're getting your blood work done. It's all right in the doctor's office to stop and say, hey, I have a question. I want to be screened for diabetes. I was listening to a presentation that Dr. Hawkins from U of M gave, and she said that the American Diabetes Association recommends that I get screened, anyone over the age of 35, get screened for type 2 diabetes. It's all right to communicate with your doctor. They're working for you. They're getting paid to take care of you. It's all right to say and advocate for yourself. I'd like to get screened. If you already have type 2 diabetes, hopefully they're already checking your A1C levels. And when I say A1C, I just mean your blood sugar levels. And as you age, that becomes more important. So make sure you're getting that blood work done. I mentioned before, if you aren't managing your diabetes, it's not getting treated properly, one of the big consequences is foot complications. So it's very important if you have type 2 diabetes to check your feet for sores every day, to look into your shoe, make sure there's not anything in there. Why? Because you could potentially have an ulcer. And as I mentioned earlier, foot sores are somewhat common in folks, older adults with type 2 diabetes, because it affects your blood flow. So you might know someone with type 2 diabetes, they're talking about neuropathy. So their fingers might feel numb, their feet might feel numb. Again, like I said, type 2 diabetes impacts the blood flow. And so that can result in ulcers, which are a breakdown of the skin on the foot, and that can be very difficult to heal. I talked about neuropathy, which causes numbness, burning, or tingling, and it diminishes, so it decreases the sensation in your feet. And again, if untreated, if an infection develops, amputations can occur as a result of these foot wounds and these ulcers. So it's important to check your feet every day. Diabetes is the cause of more than 60% of non-traumatic lower limb amputations. So again, important to check. And this parting thought, remember, type 2 diabetes can be overwhelming when you first get that type 2 diagnosis or a pre-diabetes diagnosis. My mother was diagnosed about 6 years ago. She was scared. She felt a sense of despair. But then she realized that good nutrition, exercise, checking her blood sugar regularly, and taking her metformin, 6 years later, she's doing great. Does she have some of her favorite foods every now and then? Yes, she does. But she's out being active, trying to do the best that she can, and following these guidelines. So it's not something that needs to impact your life in a super negative way. It doesn't mean that things are over, things are downhill, or anything like that. If you're able to adhere to these guidelines, so that good nutrition, the exercise, blood glucose monitoring, and making sure you take your medications, make sure you keep your appointments, and advocate for yourself. So the last thing I want to mention is that my research that I do, again, in Detroit and in Washtenaw County, is to think about ways that we can help older African-American men better manage their diabetes. Why older African-American men? Because in general, in my personal experience, but also in the work that I've done, it's a bit harder to get them involved in programs for type 2 diabetes. It's a bit harder to get them to go to regular doctor's appointments. So I spent a lot of time over the last 10 years talking with older Black men about why they may go to the doctor, why they may not go to the doctor. And unfortunately, many times not going to the doctor means that you present with a more severe case of type 2 diabetes with those complications that I mentioned, which unfortunately older African-American men are more likely to present at later stages, which means they have more severe complications. So for folks on the line, if you have men in your life who might not necessarily go to the doctor regularly, or if you yourself are thinking, hey, I think she's talking to me, it's important to do what you can to get to the doctor and to get screened, and then to do the best you can if you do have type 2 diabetes to manage your diabetes. And one way that I've worked with men in the community in Southeast Michigan is to train men who already have type 2 diabetes and who've been doing a reasonable job of managing their diabetes to work with other African-American men who have type 2 diabetes to support each other. So we call these men peer leaders. And I ran a program last fall where we had men in several sessions together, about 6 sessions where they got support from their peer leader, but they were also able to support each other. Each session was an hour and a half, and there also was a certified diabetes educator there to answer any questions that they may have had about their medications, about food. But the biggest thing was them developing a support system and a sense of community in thinking about the challenges, the unique challenges that older Black men face who have a chronic illness like diabetes. So I encourage everyone, if you're able to sign up for any registries to be a research participant, you might get a great opportunity to be in a program like the one that I launched last fall. And it really will help ultimately for us to work with the healthcare system and the community to make sure that we have programming for folks like you to help you lead healthier lives. And I'll end there.